back to March 11th, 2020. That was the day the World Health Organization declared COVID-19 a pandemic. 2 days later, the United States declared it a national emergency. Our understanding of this deadly and highly communicable illness was very limited at that time. The availability and accuracy of testing to detect the virus was limited. We could not be certain who might be carrying it. Patients were afraid to come to their appointments, and healthcare workers were afraid to come to work. Meanwhile, echocardiography was needed by our patients. Hello, I'm Dr. Patricia Pellica, the Betty Knight Scripps Professor of Cardiovascular Diseases Clinical Research and a Vice Chair for the Department of Cardiovascular Medicine at Mayo Clinic. I would like to tell you about our paper, Safe Operation of an Echocardiography Practice During the COVID-19 Pandemic, Single Center Experience, published in Mayo Clinic Proceedings. Drs. Vito Anand, Jeremy Thaden, and Garvin Kane co-authored the work. Echo plays a key role in the detection of cardiac complications of COVID-19, but also in the diagnosis and follow-up of many other cardiac conditions. Thus, it was readily apparent that opening and operating our Echo lab during the pandemic was essential for our patients and could not be deferred. We wrote this paper to describe our procedures because we believe that our methods and messages might be helpful to other practices and laboratories. We have a very large and busy laboratory which employs more than 200 physicians and allied health staff and performs about 70,000 echocardiograms annually and about twice that many across the Mayo Clinic enterprise. It was necessary for the lab to continue to provide service to both inpatients and outpatients throughout the pandemic. Our paper details how we implemented the use of personal protective equipment for our staff. This was especially critical for those involved with aerosol generating procedures like exercise echocardiography and transesophageal echocardiography. The paper also specifies the special cleaning of rooms and ultrasound systems, including the use of special fluoroscopy drapes on the ultrasound keyboards, which would be hard to clean. It explains the alterations in the clinical schedule that were made to allow for air exchanges of the rooms between patients to ensure 99.9% clearance. For transthoracic echo, our standard clinical imaging protocol was adapted to reduce the time of our sonography staff at the bedside, not only for patients with COVID, but with possible symptoms or pending test results. Scanning techniques were modified for prone position, mechanically ventilated patients. Our paper details our methods and protocols. In addition to our clinical mission, education and research are important activities of the laboratory. At any given time in our lab, we have about 40 learners, including sonography students, residents, fellows, and medical students. The physical space of the laboratory was completely reorganized to accommodate workstations 6 feet apart. Our paper explains how we continued our educational conferences and research. Even in our healthcare environment, including directly caring for patients with COVID-19, we have managed to keep our patients and staff safe. We still do not know exactly how COVID-19 will continue to impact healthcare in the future, and it is likely that some of our practices are changed forever. Please read our paper to find out how our lab has continued to provide excellent patient care and learner education. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.